Gather the equipment onto the trolley, making sure there is a sharps bin to hand. Do not put the unopened equipment in the tray at this point. Open the blood culture pack and arrange your equipment in the tray, ensuring all key parts are protected. Check the expiry date on the blood culture bottles. There is a barcode that must not be removed. Also check for contamination, which is indicated by a yellow discoloration on the bottom of the bottle. There is a milliliter scale on the side of the bottle to help you take the correct amount of blood. Repeat this process for the other bottle. Remove the rest of the contents of the blood culture collection bag, checking the expiry dates of the equipment when appropriate. Once you have done this, decontaminate your hands and proceed directly to your patient. At the patient's bedside, decontaminate your hands and reconfirm the patient's identity against the blood culture request form. Make sure that the patient is happy for you to proceed and position them so that they are comfortable, ensuring your equipment and sharps bin are within easy reach. Apply a disposable tourniquet to the patient's arm and palpate for a suitable vein. Once you have located the vein, release the tourniquet. Remove the ChloraPrep applicator from its packaging and squeeze until the inner tube breaks. This releases the ChloraPrep solution. Clean the proposed puncture site in a hash formation and allow to air dry for 30 seconds. Dispose of the ChloraPrep into your sharps bin. Decontaminate your hands and remove the plastic caps from the culture bottles. Clean the newly exposed bottle tops with the chlorhexidine wipe for a minimum of 15 seconds each and allow to air dry. Open the collection set, ensuring the key parts are still protected. Partially open the sterile gauze and remove a strip of tape in preparation for use later. Decontaminate your hands and apply an apron and non-sterile gloves. Reapply your tourniquet to distend the vein. Do not repalpate the cleaned area of skin. Take your collection set and remove the plastic sheath from the winged needle. Apply traction below and to the side of the proposed puncture site to help immobilize the vein. Advance the needle bevel up into the vein. Once the needle has punctured the vein, you can release the traction on the patient's arm. Whilst immobilizing the needle with one hand, take the aerobic blood culture bottle and pierce the septum using the adapter cap. It is important to fill the aerobic bottle first, as there will be air within the collection set. Hold the bottle upright and collect 10 milliliters of blood. Remove the aerobic bottle and repeat the procedure with the anaerobic bottle. Remove the anaerobic bottle and release the tourniquet. Without pressure, apply the sterile gauze to the puncture site. Withdraw the needle and pull the wings up to resheath it. Unscrew the adapter cap and put the needle immediately into the sharps bin. You can now apply pressure directly over the puncture site. Use a piece of tape to secure the dressing. Remove your gloves and apron, decontaminate your hands, and turn your attention to the blood culture bottles. Label the bottles at the patient's bedside. Place them into the request form bag. Place this into the blue blood culture bag and seal it. A biohazard bag must be used for samples. Once the culture bottles are in the bag, thank the patient and make sure that they are comfortable. Tell the patient that if they begin to experience any bleeding, pain, or signs of infection such as redness or swelling, then they should notify a member of staff. Before leaving the patient area, you should recheck the puncture site and decontaminate your hands.
After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using 2 identifiers.
May I see your wristband? And would you tell me your name and date of birth?
Philip Reynolds, June 25th, 1935.
Good, thank you, Mr. Reynolds.
Before collecting a wound drainage specimen for culture and sensitivity testing, assess the patient for signs and symptoms of infection, such as fever, chills, and excessive thirst. Ask him to rate his pain at the wound site. Apply clean gloves and remove the old dressing. After you've assessed the bandage for drainage, fold it together, soiled side in, and dispose of it in the appropriate receptacle. Now remove your gloves and apply sterile gloves for assessment. Assess the wound by looking for swelling, separation at the edges of the wound, inflammation, and drainage. Cleanse the area around the wound edges with an antiseptic swab. Wipe away any old exudate. Discard the antiseptic swabs. Remove and dispose of your gloves and perform hand hygiene. Then unwrap the sterile culture tube and apply a new set of sterile gloves. To collect a specimen of aerobic bacteria from a wound, remove the swab from the culture tube. Gently insert the tip of the swab into a part of the wound that has fresh drainage. Rotate the swab and return it to the culture tube. To obtain a specimen of anaerobic bacteria, remove the swab from a special anaerobic culture tube. Insert the swab deep into the cavity of the draining wound and gently rotate it. Then withdraw the swab and return it to the culture tube. An alternative method of obtaining a specimen is to insert the tip of a needleless syringe into the wound and aspirate 5 to 10 milliliters of exudate. Then attach a transfer device to the syringe, expel the air, and inject the drainage into an anaerobic culture tube. Regardless of which method you use, be sure to label each specimen tube and verify information in front of the patient. Make a notation on the label if the patient is receiving antibiotics. Place the specimen in a biohazard bag, remove your gloves, and dispose of them appropriately. Perform hand hygiene. Apply clean gloves and clean the patient's wound if required by the healthcare provider's order. Open the dressing supplies and cover the wound with a new sterile dressing. Remove and discard your gloves and dispose of the soiled supplies in the appropriate receptacles, according to your agency's policy. Perform hand hygiene. Help the patient into a comfortable position. Send the specimen to the laboratory immediately. As part of your follow-up care, review the culture and sensitivity test results when they come back from the lab.